Hello. Hello. All right. So, so let us start the Nash therapeutics study streak for 18th Jan 2025. And so far, we have covered almost a 50 odd or 50 plus remedies. And we are on course to do more number of remedies and finish Nash therapeutics before we turn to any other book. So, what are the remedies that we will pick up today? Digitalis, cactus, spigelia, and calmia. These are the four remedies that we'll pick up. The reason is that all are heart remedies, all work on circulation, and after these four remedies, the set of remedies which Dr. Nash explains in a group changes. And before this, there were different remedies. So Dr. Nash gives a very beautiful explanation of all the remedies one after the other. And if you study these remedies in comparison with each other or in differentiation, it's going to help a lot clinically, practically, and something that you can reproduce in your clinics every day or see in your clinics every day rather. So digitalis, Dr. Nash tells us that it's a cardiac tonic as claimed by many homeopaths, but homeopathy knows no such thing as a tonic. Why? Because the word tonic itself seems to be like abusing a medicine to take in large quantities, which is not what homeopathy is. So, what Dr. Nash tells us is that you shouldn't say that digitalis is a cardiac tonic, but you should say that it is specific for some class of diseases or some class of patients, such as those who have slow pulse or those who have quick pulse, or in between there would be irregular or intermittent pulse. So all the cases, and this is the first sign and the last sign in all the cases, whether it's a simple case of sunstroke, jaundice, or liver complaint, heart complaint, collapse, coma, anything, pulse is the first thing that you will notice in patients while examining and also in digitalis. So good to see Dr. Lata Somyo Kakinada and Kushal Baldania, Dr. Samuel Kumar, Dr. Purvi. I don't know how many of you are online. And let us see, there is some issue in. Yeah. So, digitalis is a remedy which shouldn't be thought of as a cardiac tonic or something that will uh, improve the heart or work on the heart to improve its tone or muscle tone or regularize its rhythm, but something that should be individualistic to the case. And if we understand this aspect, our job to prescribe this remedy becomes very easier. Okay, so what is there in Digitalis by Dr. Nash? And every homeopath would want to give lines and lines of materia medica, lines and lines of paragraphs of materia medica case discussions, or something that was seen in proving, something that was given in different materia medicas. But what Dr. Nash gives is something that is very much practical, something that is very much what he saw with his own eyes. And he gives us two beautiful examples, two cases in the remedy digitalis, which will open our eyes to how we should examine patients and see patients and give the remedy digitalis. The first case, he says that he was in his clinic and he saw someone from his window, and that man was kind of staggering, having a vertigo episode or having giddy feeling, and he was moving here and there, not in proper gait. He sat down somewhere. Dr. Nash went and saw him, and what he saw was that this guy was very much weak, debilitated, and running a slow pulse. He brought him to the clinic, auscultated the gentleman, old man, and found that in the first heartbeat itself, there is a kind of a sound which is in addition to the heartbeat. That is where he thought that digitalis is the remedy that he should give. Have How many times have you examined a patient in the chest and given digitalis? It will be rare. It will be based upon other symptoms. But to understand the patient on the basis of heart symptoms, lub dub, what we say or what we study in academics uh, in our academic education graduation period. This is what Dr. Nash did. And he also found later on short case taking, that the patient also had inflammatory rheumatism in the past when he was young, and he couldn't leave up his job or do something else because he was told that there is a heart disease and he needs to also work to earn some money. So Dr. Nash gives us a beautiful case, and he gave digitalis just by seeing the gait of the patient, bringing him to his clinic, examining him, and getting the short history. We take few hours or few minutes to understand this entire procedure. Dr. Nash could do it instantly. Why? Because his clinical materia medica was very strong. So that is what every one of us should do. We should read such books and such literature which will give us a clear idea of how you will examine the patient, what you will see, how you will see, and that's it. No theorizing of any particular cases, no boasting of any such bigger words or terminologies. That's it. Dr. Nash gave digitalis two potency, number two, second centesimal potency. This is the beauty. How he gave, what was the repetition, how many times, we don't know, but he just mentions this. Case number two by Dr. Nash in the Remedy Digitalis in Leaders in Homeopathic Therapeutics. Dr. Nash tells us that there was a young gentleman with jaundice, all the features of jaundice present: nausea, vomiting, discomfort, appetite lost, etc., etc., etc. On examination, he found the pulse is 30 per minute. That's where he decided to give digitalis. So digitalis is a remedy which we should think of in cases of jaundice, in cases of slow pulse, and that is what Dr. Nash tells us. In both the cases, a short introduction of materia medica of the remedy in the beginning and followed by two cases for a page long, that's more than enough for us to get an idea or glimpse into the remedy of how he prescribed this remedy clinically, practically, by seeing the patient, auscultating the patient, examining the patient pulse, and that's it. And we have a lot of theories springing up everywhere telling us that this is the rare rubric of digitalis, this is the rare presentation of digitalis. Why we complicate things? We should make it simpler. We are making it complicated. Good to see many people joining today. Sanawar Ali, Homeopathic Era, Deepali Bhosle, and Shri Chalam, Homeo Lovers, Tariq Raza. I don't know how many of you are online, but any which ways, good to see a lot of people taking an interest in our old and forgotten author, which is Dr. Nash, Leaders in Homeopathic Therapeutics. Today we are discussing four remedies. One of them is uh, good to see Dr. Garima Singh on YouTube as well. So we are live on YouTube and Instagram simultaneously. There is Homeo Setu YouTube channel and Homeo Setu Instagram channel or Instagram profile, which you can follow. On YouTube it is with the PowerPoint, so you can definitely uh, get an experience of the content which is simplified and easily available. So let's go further and understand what Dr. Nash tells us about digitalis. Dropsy is connected with heart disease. Any patients that we see, we have edema of the legs or any part of the body, especially legs, in heart disease, and there is a heart history which is going on or past history of heart disease, we can think of giving digitalis. This is right away from the desk of Dr. Nash. Skin bluish, venous stagnation are other presentations, but they are not renal disease cases, but heart disease cases that we should think for digitalis to be prescribed. Weak heart, slow pulse, and vertigo, especially in aged people. The first case that I mentioned, those who are joining late, you can go back and see the first case which Dr. Nash shared in his practice about digitalis. That's very simpler explanation of digitalis. Passive congestion of lungs is for digitalis, and when the patient goes to sleep he gets out of breath, just like grindelia and lachesis. So we often prescribe these remedies but we forget digitalis because we don't know how to prescribe, when to prescribe. Dr. Nash gives two cases and some key features of what the remedy looks like clinically. Go and read from Leaders in Homeopathic Therapeutics by Dr. Nash, and your job to prescribe digitalis would become easier. Next remedy which we'll take up is Cactus grandiflora. He tells us in the beginning itself it is another heart remedy, but not like digitalis. So, in all the remedies that we have discussed so far, he mentions not only about that remedy but about other remedies as well. And that is the first job of homeopathic physician, to differentiate one remedy from the other, to compare one remedy with the other, and go further. The next few lines, if you are on YouTube watching Homeo Setu YouTube channel, you will see in the PowerPoint presentation, I have put what Dr. Nash tells in a paragraph. I have put in a beautiful chart, a simple chart, but differentiates what Dr. Nash tells us: cactus, iodum, lilium tigrinum, lachesis, arsenic album. Five remedies he gives in 5 or 7 lines, and that's it about the heart symptom of these remedies. Cactus has sensation of constriction of heart as if there is an iron band. This is there in cactus. Iodum has the feeling that the heart is squeezed together. Lilium tigrinum has the feeling that the heart is grasped and released alternately, which is also what we see, that the patient is, having this activity fruitless and desire to work, and also represses her thought somewhere. This kind of connection also, if we see. So Lilium tigrinum heart is grasped and released alternately. And Lacase's constriction on awaking, everything that happens on awaking throws off the covering. And Arsenic album, constriction or operation when walking. He wants to walk, but he can't walk because there is constriction and operation. Five remedies Dr. Nash gives in 5 or 7 lines, and that's the explanation for the differentiation of these five remedies about the heart symptoms. Next, Dr. Nash tells us in his book Leaders in Homeopathic Therapeutics that in Cactus grandiflorus, there is everywhere the constriction that you see. And like the Aesculus hippocastanum remedy has fullness everywhere, Cactus will have constriction everywhere. Also over here you will see what Dr. Nash says, that everything that has happened due to a rheumatism or joint pains in the past history of the patient, inflammatory rheumatism, is what we will see the patient presenting with a heart complaint. Cactus can be thought of. Heavy weight on the vertex like that of gluonine, if it is a patient who is in menopause, climacteric age, lachesis should be thought of. All hemorrhages or hemorrhage related troubles with the heart disease or connected with heart disease, think of lachesis, think of cactus as a remedy, and lachesis if it is climacteric. Now, cactus as a remedy to prescribe is difficult, but Dr. Nash gives us 7 or 8 lines of explanation. I have not picked up all of those, but just something that is very important or key is that there is numbness of left arm and edema of left hand or left foot or left leg. So there would be one-sided complaints like that we see in pulsatilla. We have given pulsatilla, we have failed, and we will find that heart troubles is also there for the patient. Cactus can be thought of. Periodical attacks of suffocation and fainting, and there is cold perspiration. So we will be giving veratrum album, we will be giving lachesis, and we'll get stuck. But if there is a heart pathology which is very strong, past history of joint pains, think of cactus as a remedy with the loss of pulse. That's where we complete cactus as a remedy in from Leaders in Homeopathic Therapeutics. Next we have is Spigelia, the third remedy for our discussion from Leaders in Homeopathic Therapeutics by Dr. Nash. So this is the entire description which Dr. Nash mentions, and not the excerpt of first 5 or 7 lines of the remedy, which is the gist of the remedy. Okay, you can read the gist of the remedy from any book or even from Nash, but what he gives in the paragraphs below with the cases, with the explanation, with the knowledge of how you should see clinically the patient is very important, and that is the main crux of reading Leaders in Homeopathic Therapeutics. For Spigelia, the pain in the heart are very severe. Action of the spigelia is violent than that of cactus or digitalis. So if you are undermining spigelia as a remedy to be thought, for heart troubles, think 2 times, because what is mentioned by Dr. Nash in his book is something that is, an eye opener, and he tells us that action of spigelia is more violent than that of cactus or digitalis. And he tells us that it is visible to the eye, it is so much powerful. You can see through the clothes, there is pulsation, palpitation, it shakes the whole chest, the sounds are audible inches away. And this is a good remedy for acute attacks of the hearts. If anyone gets a chance, very rarely, keep this remedy with the patient who has a heart problem, aconite and spigelia. You will find immediate relief in the patient, not Rustox, but aconite and spigelia. Chronic valvular affections after the acute attack, if a patient has or has had a myocardial infarction resolved by some method, and now he is having some valve issues, mitral valve, tricuspid valve, spigelia is the remedy you should think of with palpitation if it goes on. And also patient can lie only on the right side like phosphorus and natramure, or he will lie with the head very high because the least flat position would make him suffocate. Spigelia patients, Dr. Nash tells us, are also aggravated on least motion like the remedy nausea tripudens. Spigelia as a remedy is very often neglected in neuralgias, especially of the head, eyes, and the face. And headaches are one sided, they settle over the left eye. If it is right eye, on my screen it would be looking opposite because I don't know, the settings are different. But you can consider that I'm telling you what exactly is there in the book and what I see in my patients. Left eye, left sided complaints, I right away think of the remedies Pygelia, pulsatilla, rustox, lachesis. Right-sided affections, sanguinaria, silica, belladonna. Then you have lycopodium, even Merck sol, right to left, left to right. The Merck compounds, iodflavum and iodrubber. You can think of for throat complaints or connected neuralgic complaints. So Dr. Nash tells us that Spigelia is a good remedy for headaches that are one-sided, aggravated by noise, jar, aggravated by rising of the sun, and goes down as soon as it is sunset. Natramur and tabacum are the other two remedies. The interesting part of spigelia pain, especially the headache, is that there is lacrimation from the affected side, especially the left side. If it is right side with lacrimation, then it is chelidonium. So, very beautifully in one page, Dr. Nash gives us an idea of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12 to 15 remedies. Sanguinaria silica for headache, chelidonium for lacrimation with headache, and then Dr. Nash tells us that Spigelia has also ciliary neuralgia, stabbing and running pains, and pressing outwards. That patient would feel that there is kind of something that is pushing from within, in the eye especially. This was also there in Actia resmosa, we covered recently. Spigelia as a remedy is also affected by rainy weather, like the remedies Bryonia, Calmia, Natramure, and Actia resmosa for motion aggravation, and Belladonna for noise aggravation, and China for touch aggravation. So, Spigelia can be compared with all these remedies for certain issues, or if you feel that there is a combination of all these different remedies, then think of Spigelia very strongly. Last but not the least, he tells us that Kalmia at first seems like Spigelia. Okay, so we come to the next remedy, which is Kalmia actually, and in Kalmia, it's a continuation of Spigelia actually. So it looks like it is, the Spigelia remedy only which Dr. Nash discusses, but he continues the discussion of the remedies with only the change of the title, but he goes on mentioning about the remedy in comparison and differentiation. So that's why I also missed out on the words. But if you see that after Spigelia, he immediately mentions Kalmia, and he tells us that Kalmia at first seems like Spigelia. And Herring says that if you have given Spigelia to a heart patient, you follow it well with Kalmia. That would relieve the patient a lot. Both the remedies have severe neuralgia, heart troubles, which originate from the joint problems. So, 10 years ago, 5 years ago, any time before in the history of the patient, if the patient has had any joint pains, any fever or joint pains, and treated with allopathy, or he was given some medicine, or he got palliated in the joint complaints, and he now 20 years down the line, when he is in his 40s and 50s, reports to you with heart troubles, think of the remedies Kalmia, Cactus, Spigelia digitalis. The entire description is there in all the different Materia Medica books. Dr. Nash gives it with the different cases that you will be able to clinically identify in your practice. So for Kalmia, he gives us comparison of Spigelia all through the remedy Kalmia. He tells us that Spigelia is left-sided, Kalmia is right-sided. He tells us that Spigelia has eye pain, but there is no stiffness, whereas Kalmia has lot of stiffness. It can be in the neck, it can be in the head, it can be around the eye or some muscles around it. And Spigelia will tell you that there is a feeling that I can't fit my eye. There is some reason why I feel that eye is pretty much bigger. Kalmia does not have any such complaint. This will also be seen mostly in glaucoma cases. Spigelia is a near specific for all the glaucoma cases. You will also find out for yourself. Another few remedies are Comocladia and Coculus and Causticum and Glomine also. So we are on the Nash therapeutics and we stick to it. Dr. Nash gives us differentiation of Kalmia and Spigelia, and for Kalmia he tells us that there is no such pain, that there is kind of restricted feeling or feels that it's too large, the eye is too large. But Kalmia has slow pulse like that of digitalis. The rheumatism or the joint pain is from the top to the bottom, about onwards. Leadum pal will have opposite. And the pains shift in nature like that of pulsatilla. And he tells us that all the cases where I feel that pulsatilla is indicated and joint complaints are there, I go ahead with Kalmia. So that is the beauty of Dr. Nash's therapeutics. You should know that where you should give which remedy, how it is similar, and how it is differentiated from the other remedy. Last but not the least, Dr. Nash tells us that Dr. Nash quotes Herring that Kalmia as a remedy has weakness as a general symptom with the neuralgia, and also there is lot of numbness or localized numbness which you will see also in remedies Aconite, Chamomilla, Graphalium, and Platina. So that's all from today's session on four remedies: Digitalis, Cactus, Pygelia, and Kalmia. If you have joined late, you can just go through the recording. It was from Leaders in Homeopathic Therapeutics. If you have the book Leaders in Homeopathic Therapeutics, go through the book. Dr. Nash gives one or two cases in each remedy, the potencies, the way he prescribes these remedies, how he repeats, or the confidence that he gives by his philosophical insights is undoubtedly the best. uh, for continued learning and interesting learning coming up in 2025, follow Homeo Setu on Instagram, YouTube, Facebook, WhatsApp channel, everywhere, and stay connected so that you have an upgraded practice in 2025.